Thank you, Mr. Chairman. Again, to the panel, thank you for your presence and your help. First question here is bottomed on some premises that are interesting. What's striking about each of your stories is that in medical emergencies, that your insurance policies had shortcomings, which have limited your career options. Mr. Null, in your testimony, you mentioned that you had to lower your income in order to qualify for Medicaid. I understand that because you're a small business owner, that decision affected your business. I gather it related to having to turn away business to reduce your income so that you could qualify for Medicaid. Is that statement true?
Yes, it is.
But tell us a little more about it, if you please.
Well, the limit was $1,613, and because I am self-employed, I am the salesman for the company. I am the collector, so I know exactly how much I'm going to make. If I knew I was going to make too much in order to be able to requalify for Medicaid, we would have to turn business away, and I would be unable to take on that business because I knew I would make too much for the Medicaid limits.
Thank you. Now, Mr. Wilkes, you told us how you had to leave a company that you liked to work for in order to get better coverage for your son. What would you like to tell us about that, please, sir?
Well, they didn't want me to go. I was basically employee number 9, the lead engineer of the company that we started in 2000. The company survived the .com bust. The company then was struck facing these rising premiums, and they kept me around for over a year. While we were dealing with this, I literally walked the halls of the company, felt like I had a big giant target on my back. I'm very close to other members of the hemophilic community, and I hear horror stories every time I talk to these people about how they started a great job, they were doing well, they were performing, they were the top salesperson, and as soon as somebody in the company found out that they had a kid with hemophilia with high cost illnesses, they were terminated or let go, or their job was no longer needed. So I felt, I had that target on my back. I felt like I had that target on my back for over a year. When it came time to leave, I said, I have to go. I don't have insurance unless I do this, and they didn't want me to go. They worked with me. They did everything they could, and I feel blessed that, guardian angel looking over me and my family, that they were able to do that. But I know that's not the case for a lot of companies and a lot of people across this country.
Now, I gather that you on the panel have all had to shop around for insurance policies in order to meet your needs. Did you find that to be an easy process, and did you have an easy time of comparing your policies, or rather your choices amongst policies, so that you could come up with the best choice for you and your family? Did you find it easy to know what the benefits would be, what the restrictions and the constraints were, what would be the costs, and what would be the duration of the policy and the other circumstances, including pre-existing conditions and questions of that kind? Would you want to start, Mr. Null?
We found shopping for insurance to be very confusing. In fact, in Texas, it requires a licensed agent in order to even be able to come talk to you about policies. It's so confusing. My wife and I, we're both college educated. We believe that we're able to make good decisions, but being able to look at these policies and tell the difference. For example, this policy that we were on when Tatum had her illness, this policy was only 25% less than the policy I'd been on previously with traditional caps in it that would have done our family much more service. It was only 25% less, and yet the cap was 1/40th of a comparable policy. No, we did not recognize anything along those lines when we were shopping for that policy. Had we have seen something like that, that would have raised red flags, and we probably would have recognized that policy for being the worthless piece of trash it was.
Mr. Wilkes, you want to make a comment on that?
Yeah, our family had been dealing with this issue for over 5 years by the time it came time for us to actually shop for a plan. The policies themselves were very difficult to comprehend. The one thing that was really in my favor is that I was able to find an insurance broker who had cancer herself and really believed that the private insurance market has no business even existing in this country, and knew all the ins and outs and knew what to look for. I had her in my favor who was being an advocate for our family, and I also took the plans. I mean, in Colorado there's like 20 some different insurance companies that you can pick. We went to our hemophilia treatment center and said, which of these companies is least likely to deny care, is least likely to give you any problems, is least likely to cause us problems when we go to the hospital. And out of those, there were only 2 that they said they have the least problems with and they can work with and pay bills on a regular basis. So, and we had 2 insurance companies out of the many that offer that were really even an option for us. And beyond that, we had to work with our insurance broker who fought the fight that we fought before and knew what we were dealing with.
Thank you. Ms. Howard, do you have any comments on the last question?
I do. I feel like there's a real need to provide consumers with assistance in making sense of these plans, to give us an apples-to-apples comparison. You know, like Mr. NULL, I have now a master's degree, and I couldn't make sense of that policy. I really feel like it behooves this subcommittee to write into the bill that we just have to understand what we're signing up for. What would the cost be? What would the coverage be for unfortunate but common conditions like my own, like breast cancer or other common conditions? What would the financial ramifications be for an individual or a family?
Mr. Chairman, I thank you for your courtesy. Members of the panel, thank you for your very fine testimony.
Thank you.
Mr. Welch, for questions, please. We got 2 votes, but let's try to get through some more questions before we have to go.
I just want to